would like to welcome Grant, that is the person in charge of Oscar, and explaining how Oscar is going to work for you and this opportunity as well. So welcome, Grant, and thank you for joining us.
Thanks, Daniela. Hi, y'all. My name is Grant Center. I'm the market executive for Oscar Health in Florida. We've partnered with Claro Insurance to really market to the tax preparer this year based off data that we've seen in our own enrollments from health insurance brokers that shows that tax preparers are the highest producing brokers from a health insurance perspective in the state of Florida. And so you have tax preparers that have really discovered that the key to lead generation comes through the ACA, so the Affordable Care Act, providing members health insurance as sort of a gateway to getting them to become clients for your tax preparation business. But it also goes both ways, right? You can take existing tax clients, turn them into ACA consumers and make some additional money there, or use it as a lead generation opportunity. So the opportunity is vast across the state of Florida. Oscar's footprint is equally vast across the state of Florida. We have hospital system partners from HCA to Advent Health across places like Central Florida, Memorial Healthcare System like in places like Broward, Holy Cross, Tenet, Baptist Health. So we typically partner with the top hospital systems in certain geographies. We offer our health insurance plans on the marketplace, so healthcare.gov. You may have heard of healthcare.gov. And due to recent subsidy changes from the Biden administration, a lot of these plans are now going to $0. So we are offering incredibly affordable plans for $0 that members can get health insurance with low copays and deductibles, access to thousands of doctors across our networks in Florida and across the country, free and unlimited telemedicine, concierge level type service when your clients interact with an Oscar care team. And, historically, we've been the highest rated health plan, according to bestcompany.com. So we are a health insurance plan similar to maybe names you've heard of in the past, like Florida Blue. We compete with Florida Blue, but offer a much more sort of hands-on customer-centric approach. So this slide is just to give you a little idea for sort of what the benefits look like for the majority of Oscar consumers. Obviously, this is going to vary by income level, which is kind of how the ACA operates. It is a income-driven sort of health insurance system. So the lower the client's income, and if it's within certain bands, in this case, this is 100 to 150% of the federal poverty level. And I'll show you some examples of what that looks like here on the next slide. But you can see some of the benefits here. So $0 deductible across all health insurance plans that are ACA, just about for the silver tier. You have out-of-pocket maxes. So this is the maximum amount of money your client can spend in a year on healthcare expenses that are in network. $1,600, $1,500. That's very, very affordable and crazy low if you guys have any indication of kind of what group plans or small group plans charge. PCP visits at this level are free. Specialist visits at $10, labs are free with Oscar, and then any generic prescriptions at the tier 1 level are also $0. So hopefully this provides you just a snapshot of some of the great benefits and sort of the low price points offered at these benefits. And it's one of the great marketing tools, right? If you can set up shop outside your retail office or on Facebook, Twitter, whatever social media campaign you're using, and say, hey, look, I can offer you access to potentially $0 health insurance with $0 deductibles and $0 primary care visits. That's a very attractive value proposition across the board. So very exciting times to be an ACA health insurance agent. But if you're not an ACA health insurance agent yet, and you are currently a tax preparer, this is a great way to start, working with Claro, referring business, getting a sense for how this industry works, and then, of course, making some money on top of that in the meantime. So if you want to go to the next slide, Daniela. And so this is just a snapshot of price points that we're seeing with the new subsidy increases. So I mentioned, this obviously being a lead generation opportunity. And so we've seen from some of our tax preparers that are incredibly successful. I'll give you an example. There's a tax preparer office in Orlando that has over 3,000 members with the ACA. When you consider in all the commissions and the bonuses that are paid out on ACA health insurance, that individual is earning well over $500,000 a year just through their ACA business, right? That does not include the money they're generating through their tax preparation business. We have a tax preparer also in Broward County in Central Florida that is also at that kind of 3,000, 4,000 member mark. And due to his business and the way that he's running, he's earning close to $750,000 a year. So there are examples of tax preparers that have had, gotten in early with the ACA and used it as a lead generation opportunity. But we're still seeing, even recently, tax preparers start to get in the ACA game just over this past couple of years, generating 100 members, 200 members, and still, being able to earn, 30,000, 40,000, somewhere upwards of $75,000 a year just after a couple of years of work. And adding sort of almost like a passive income. So you can see here some of the price points that Oscar is going to be at this low cost tier. So this is 100 to 150% of FPL. So it's going to vary, what the income looks like, but just a ballpark. This is, somewhere between, we'll call it $13,000 to $20,000 for an individual over the course of a year. As you get up in income, the prices increase. But still, all in all, very, very affordable health plans. Obviously you get something $0. When you go to the bronze tier, you get a lot more zeros. Bronze, for those of you that are unfamiliar, is just a little less benefit intensive versus the silver, but you get a much more lucrative price point as well. And so you can see across Central, and I don't have a slide here for South, but it's a similar story. Zeros across the board. So when we talk about lead generation, we're going to go to the next slide, Daniela. One thing that I've noticed that tax preparers tend to do, and this is kind of cliche, especially with Liberty Tax, is they put the person outside the highway, they have the sign spinning, they have the banners, all that sort of stuff. And to me, and of course, they're advertising tax preparation services. But the easiest way to generate new business for your tax preparation business is to advertise ACA health insurance. A lot of the communities that our tax preparers operate in typically tend to be a little bit more lower income, middle class. These are communities that have high volumes of ACA consumers that are really looking for some additional help in enrolling in that health plan. And so tax preparers, due to the footprint, due to the location, due to tons of different factors, really are in the best position to use ACA health insurance as a marketing vehicle to grow their tax preparation business. So I always tell this to tax preparers: don't lead with your tax preparation business. A lot of times lead with the ACA, because the beauty of the ACA as well is that typically the ACA operates between November to December, so non-tax season. So as many of you all know, you can't recruit people to be, to go to your tax business from November to December, right? You kind of have to do it in that sweet spot in the spring to late winter. But the beauty of this is you can recruit now year round for your business. So you're recruiting for taxes, during tax season. You can recruit for ACA during the ACA season, and then flip those ACA consumers to your tax preparation business when it comes time to file taxes. So tons of opportunity to summarize at hand for you all across the state of Florida and frankly across the country. I hope you all take advantage of it. Claro is a tremendous partner to help ACA health insurance agents grow their book of business, as well as tax preparers get knowledgeable about the ACA, grow their book of business, and really use the ACA as a massive income generating tool. Or hopefully, fingers crossed, as we've seen at Oscar, one day, the ACA can then, maybe potentially supplant your income with tax preparation, or even, double or triple, what you were making from your tax preparation business. So I will pause there, Danielle, and throw it back to you all at Claro.
Thank you very much, Grant, for this introduction. So yes, Claro Insurance, we are a powerhouse firm, housing industry leaders that together have well over 2 decades worth of experience in the insurance industry. So we are a broker firm. We started with the ACA when the ACA market and we have growth over the years. So consistently and successfully outrank the competition and have proven to be one of the fastest growing brokerage firms in the nation. So this is pretty much the reason why the tax preparers or people that is looking to start selling ACA is joining us, because we have the experience and we know how to make your business grow. Our business, because if you grow, we grow. And that's the idea for all the agents, even if they are insurance agent or tax preparers as yourself. The idea is for you to start working on growing your business, because that way we're gonna grow as well. So here in Claro, we believe that empowering our agents, providing them with effective sales tools and resources that are required to be successful. We provide value and revenue. That's our number one priority. So we pride ourselves on investing in ensuring that our agents meet their sales and commissions goals. The ACA market is known because they give commissions to the agents because of the enrollments. And since there is an open enrollment period for ACA every single year, this is the time when the agents are desperately looking for more clients, people. That way they're gonna assure the commission for the upcoming year. This year we have an excellent time because since Grant said before, the Biden administration opened up the enrollment period. So we don't have to wait until October to find new clients. We can start working on finding new clients right away, because this is the time. And since you are just leaving the tax season, I think time to target those clients and just cross-sell with them this ACA business as well. So we have built a solid management system to recruit, retain, and develop top producing agents and agencies, supported both in our data and experience. We define ourselves as an insurtech platform. We have a lot of tools and resources for all of our agents. What we're here is that you, as a tax preparer, you're not insurance agents. And the good thing is that it doesn't matter. At this point, it doesn't matter. You don't need to know about the subsidy. You don't need to know how the plans work. You don't need to study and get the license to see how the metal levels work, because we're gonna help you with that. We're gonna help you with the sales and still money for referring those clients. So Claro Insurance, we have presence in 8 states, and we're looking to expand our business to different states this year. So that means that we're not only here in the state of Florida, we have Texas, Georgia, North Carolina, South Carolina, Kansas, Ohio, Mississippi, and as I told you before, we're looking to expand to new states. And business, well, our focus is the ACA line, which is the marketplace, but we also do life insurance, Medicare, and supplementary insurance such as dental, accident, and other type of insurances. So the reason why we are here is to know how you guys are going to refer the clients to us and how we're going to make the sales for you to start making money. It's a really simple process. As I told you before, you don't need to certify to sell, because you're not going to do the sale. What we're going to require you is to send you your client's information, so one of our agents or one of our representatives can call that person and make the sale. That's what I told you before, that we don't need to, you don't need guys to go and look for the plans and see what is the meta level for your client, or what is the plan that fit the needs of your client. it doesn't matter. It doesn't matter because at the end, that's a process that we are gonna do, that we're gonna take care of you, and we're just gonna require simple information of your client so we can contact them. What is the information that we're gonna request? The first name, the last name of the client, the date of birth, a phone number for us to contact them, the email, the income, and information that you guys have access to, the number of members in the household that you guys have access to this information as well, zip code, address, and their social. If you see right here, it is not a required field, so that means that it is not necessary at this point. It will be great if you send us that information so we can go ahead and look for the application that the client is currently enrolled. But if it is not an information that you currently have, it doesn't matter, we can start working with the client as well. So then when you register your referral, we're gonna receive that information, and as I told before, one of our agents is going to contact the client, let them know that you, as the tax preparer, refer that client, and let them know that we're gonna start working on the ACA plan they want. Of course, what we want to do here is to let them know what are the advantages of getting an Oscar plan, of getting an ACA plan that is going to work for them. As Grant explained before, Oscar is one of the top rated companies here in the state, and we're sure that they are gonna find the benefits of these plans. And since you see before, like the hospital network, the doctors network that they are working with, it is really like important for the clients, and that means that we're gonna be able to serve your client the way they want. Payment, how you guys are going to receive the payments on the referrals that you make. So we're gonna pay depending on the number of clients that you refer to us. And this is the value that you're gonna receive every single month for each one of the members that are. This right here means per member per month. So we have the first tier is up to 39 clients. You're going to receive $10 per each active clients per month. If you have from 40 clients to 99 clients, you're going to receive $13 per member per month. And if you have more than 100 clients, you're going to receive $16 per member per month, as long as the policy is active. So an example right here is that if you refer 150 clients to us and all of them enroll in an Oscar plan, you will receive $28,000 a year. So that's how you're gonna potentially double your income, as we promised at the beginning of this presentation. This is how your guys are gonna get commissions for these referrals. The good thing about this is that these clients are just your clients, but in ACA, on the ACA business, we pay per active member in the policy. So these 150 clients that you refer to us, they're gonna have families, they're gonna have a household, they're gonna have dependents, and if those other members enroll in the policy, that means that you're not going to have only 150 members, you're going to have more. That's how the ACA market works. Like what I've done in the past is that most of the families, we can multiply the number of the clients for for 1.5, which is the accurate estimation of the number of the household members. So that means that you can multiply the number of clients that you refer to us for 1.5, and that's the number of clients that you will be having as active members, and that's the number that we're going to start paying to you. So these commissions are going to be paid, as I told before, per member per month, as long as the policy is active. As I told you, this is a special time. This SEPC is a special enrollment period. It will allow you to sell and refer those clients. But as every single year in November, we're going to start with the new open enrollment where the clients will renew their current insurance plan or change if they want to change to another plan. So that means that if these clients keep active for the rest of the plans, well, you're still gonna have this number on your bucket every single month. So you're gonna start receiving, you're gonna make more clients, not only in the season, but for the whole year. You can just start. It's not a time right now. You don't have 2 weeks or 1 week to refer your clients. You can just refer the client as soon as you get them. And that means that you can start working with us for the rest of the year and maybe for the upcoming years as well. So what do we need from you guys? There is not a contract involved. What we'll ask you is to fill this form. You will request some details about you, your name, phone number, email address. This is contact information, your home address and mailing address in case they're different, your language of preference, so we know how to communicate with you, your date of birth, and your social security number. We're gonna request you a W-9 and a direct deposit authorization for us to deposit the commissions every single month. So those are the only documents that we're gonna request to you, and right there we're gonna send you the information and the links for you to start submitting your clients' information and referring them to us. So I think this is an excellent opportunity for you to start making more money with the same clients that you already have. One thing that we know for sure, because we have already tax preparers working with us, is cross-selling with their tax clients with ACA, and they're doing money for the same client for different type of business. So that's good, because you don't need, as a licensed agent that just got the license, they need to start looking around to find new clients. You guys don't need to find for any new clients, because you already have a book of business. You already have your clients to start working with. Those clients already trust you because they are doing their taxes with you. So that means that if you let them know that you're gonna work on the ACA, on their ACA plans or the health insurance that is the best for them, well, that means that they're gonna take advantage of that. Most of us, the clients, we don't want to have something in different places. We want to have a person that we trust and that we let know all of our information so they can start working with us. And that's pretty much what we're wanting here. We want you to take advantage of the clients that you already have, take advantage of the information that you already have for your clients, and that you don't need to know a lot of information about the ACA and how the market works, because we're gonna take care of that. You just need to assure your clients that we're gonna take care of them and that they will receive the best plan according to their needs. That's pretty much what we want you to see in this opportunity. What else? I think is really important for you to know that, well, the tax prepare season just, and I think it's ending up today. So that means that you have the time available for start cross-selling with the clients. We have a lot for you as a tax preparers. We have marketing tools for free. So that means that if you need a flyer or a card, a business card, or maybe an email or a massive SMS you can request that to us. We're gonna design that for you for free, and we're gonna send like emails to all of your tax clients, letting them know that you are going to selling ACA, and that they can communicate with you right away. And we're gonna give you those tools for free. So in case you want to know more about it, well, we invite you to contact our support team, our line, so we can take advantage of those special requirements and start working with you on how you are gonna start targeting your current clients, your season clients. So I don't know if you guys have questions about how the program works, or anything related with the presentation.
Danielle, I'll just make a quick comment. This is Grant speaking with Oscar. One of the reasons why there are so many tax preparers that have jumped into the ACA and are making tons of money off the ACA is because the key ingredient to success in ACA sales, and then as you mentioned, Daniela, cross-selling other health insurance related products or life insurance related products, is access to income. So the ACA is entirely based in the value of it off what the individual or family's income level is. And so if you all want to Google after this call, federal poverty level chart or FPL chart, you can see sort of what the income ranges are by family size and then what the percent of FPL is. And the closer you get to 150% of FPL, or between 100 to 150%, I should say, the more you get these $0 silver plans, $0 bronze plans, and the more affordable it gets. So that's why, and I know we maybe highlighted it a bit, but wanted to definitely hit it again. The most successful ACA agents are tax preparers because they have access to the member's income. And the member's income is the driving factor behind ACA sales. So if I could tell an ACA, or if I met an ACA broker or an ACA health insurance agent in Florida that was not a tax preparer, I've actually seen it. They're starting to become tax preparers because they understand that is sort of the key to success. So you all, if you're a tax preparer on this call, are sitting in just a tremendous position of influence and access to data. And so would really encourage you all to take the next step, get started, get your feet wet with Claro, and really start to leverage your data sources and your members' income data to really turn it into another income stream for you. And then, as Daniela mentioned, the sky is the limit. You all have tremendous opportunity across the board, but as with everything, it's just a matter of kind of taking the first step. So would encourage you all to do so.
Okay, so I don't know if anybody has questions or has doubts. As I told before, this is our phone number where you can contact us to find more about this program. Send you the document, and that's the only thing. You can start referring your clients right away. It doesn't matter if there are just 2 or 3 clients. As I told before, you're going to start receiving commissions from the very first client that you refer to us. That's a good thing. And we can start working on building up your book of business for ACA, and just giving the service to the clients as you will do it as prepare agent for there.
Well, thank you, Danielle. I appreciate you all hosting.
Yes, thank you, Danny.
Thank you very much. We invite you to contact us. If you have any more questions, go to the emails that we have sent already to you guys. So, and we're going to start working together as soon as possible.